already have, of course, Deborah Ronker with her $3 super chat. Thank you, Deborah. You must have high expectations for a show with just one of the doctors. And we also, it's just one doctor. There's only one person in here. Why am I wearing that? So let's go ahead and look at who else is here. Suki also. Good evening to Suki. Teresa. Hello to Teresa. And we are caught up on our messages. And we thank you for joining us on a Monday. Dr. Gawayne is not at work today, which is fine. It's a day off with his family. So that's a very good way to spend a day. And I'm here to answer your questions and conversation and have chat because this is a live program. So for people who are coming in after the fact, this was put out live as a stream and people were able to comment like Deborah and Suki and Teresa and Connie. Hello, Connie. And if you want to be a part of that, be sure to be subscribed on the channel by hitting subscribe. But also you have to hit the bell icon to get the notifications for when we go live. But generally it's 4:30 on Monday, so you kind of know and you can plan for it if you want to be a part of the medical discussion and conversation that we have. And fun too. Sometimes it does turn out to be fun. More so with Dr. Gawayne, I have to admit, it is very nice to have him around, even if I do have to wear a mask when he's here. So let me put this off to the side and pick up the phone because this is how I read your chats as they're coming through. And I see what it is that you're seeing as you see it because it's a little bit of delay on our end. I can even see what's in the frame. Jen Brown saying hello. Hello, Jen. And also Gwen Bailey and Sandra. Lots of greetings from people all over the place. And we do even have people from Northern California and England. I believe is it Teresa who's from England or is it somebody else? It is somebody else, isn't it? Teresa, let me know because I think I got it wrong. You're not from England. It's, I'm blocking on her name. You guys know who it is, who's from England, one of our regulars. And then Catherine is from the swamps of Florida. Well, I hope it's not too much like a swamp where you are, but I do know that they're down there. And Willie Wanker, where is our poop sacks? You must be referring to somebody with a colostomy bag, which is an adjustment to make for those people who have those. For those of you who aren't familiar with what I think Willie Wanker is referring to is people who have had some kind of operation on their colon and it's no longer connected to their rectum and the poop has to get out. So usually it's in the anterior portion of the abdomen here, and you have to come up with some kind of adhesive to hold an appliance on that has a bag that has to be emptied. And yeah, they don't even have to sit down to do number 2. All right, Gwen from Lansing and Teresa from Teresa, I don't know how I didn't know you were from Canada, but we are so glad to have you be a part of the show. It's probably kind of cold up there, I'd guess, with what's going on, at least in the Midwest of the United States. Ontario would be more on the east, and I'm guessing pretty cold up there. Yeah, Toronto's in Ontario, and that's north of the northern Midwest, almost eastern states. So yeah, we talk a little bit about geography sometimes on this program because of people being from all over the place. Of course, in the news, medical news, COVID-19 is still big news as we continue to vaccinate many people with big hopes for later this month having both the CDC and the FDA, their bodies that look at vaccines, looking at the Johnson & Johnson or Janssen product, the 1-dose vaccine that we have great high hopes for, that when it gets out, and then we have 3 great vaccines going around, that supply will increase greatly. And in fact, the Pfizer product, Pfizer is claiming to be able to increase their production, make it more efficient, so they should almost be able to double what they're putting out. So between that and Johnson & Johnson having a new vaccine that doesn't require the temperature requirements and only has to be given with 1 shot, we should really increase our capacity for being able to give vaccinations and get us much closer to that point of not having to wear masks all the time. Maybe we'll find out. We're hoping. Of course, there's lots of rumors and speculation as you watch the news, and I don't want to delve too much into speculation, because you can go anywhere with that. Anything can happen. But we are hoping for things to be better than they are now, and certainly a lot better than they were a month ago. We've seen that for sure. Okay, what else do we have? Who else do we have? We also have Catherine. Oh, no, we already got Catherine. Laura saying hello. Suki saying hi to Bianca. Gwen from Lansing. Laura from Chicago. Deborah, we have around 5 feet of snow right now, and it's very cold from Portola. Portola being just, oh, is it? I don't even think it's even 100 miles away from where I am here, but in the mountains and a little bit to the east and much colder than it is around here. We also have Suki in Minnesota. Oh, I'm sure Minnesota is cold right now. Real Roller 2112 saying hello and being a part of things. Catherine, if someone is highly allergic to multiple messages, such as sulfa antibiotic, oh, maybe it's medicines, etc., are they more prone to have issues with the vaccine? I'm talking anaphylaxis to penicillin coating sulfa. People who have had a history of anaphylaxis, there's more of a concern there. Certainly if there's been anaphylaxis to a vaccine, there's more of a concern, but yet not a reason not to do it. It's a reason to stick around for a full 30 minutes in a place where somebody has an EpiPen ready to go in case you were to start to have symptoms of anaphylaxis, closing up the airway and a drop in the blood pressure. So that's why we have people who have a history of anaphylaxis sit around for 30 minutes, and we do have EpiPens around. This is standard for everywhere where you're getting the coronavirus vaccine. And not necessarily not getting it. And the reason is because everybody who's had an anaphylaxis type of encounter after having the vaccine has recovered fine. And the vaccine, we want to give it to as many people as possible, even those people who've had that history of that. And it's not everybody who has a history of anaphylaxis or a similar type of reaction who has it occur in response to this vaccine. So that's why they're not telling those people not to get it. Okay, oh, Cindy Bond. So good. Cindy got the Pfizer shot and all went well. Hi, Dr. Bond. Cindy Bond from Grass Valley. Grass Valley, of course, being between Auburn and Portola, sort of. And Suki, at one point, didn't CDC talk about using double masks? I'm glad you brought that up, Suki. So yes, the big talk lately from the CDC about double masking. So taking a single mask and putting it over and then grabbing another mask and putting it over to get 2-ply protection and to kind of cover up the gaps a little bit, get a little more of a seal around the nose. Of course, they are also recommending that you use something with a little metal strip in it so can you see how that holds its shape there? That metal strip going over the nose. So if you've got a mask on and you feel your metal strip in the bottom, it's upside down. Turn it over, get that metal strip over the nose and conform it to your nose. I see a lot of people wearing the masks that have the metal strip that's meant to go over the nose, and they won't bend it over the nose. And so what you end up happening, and I can demonstrate it by wearing this one upside down, is that when they talk, actually this one stays pretty good, but I see it happen a lot that when they talk, the mask comes down, 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 and then they're always pulling it up over their nose. For one thing, using their hand and touching all over their face. And for another, their nose is still exhaling into the room and the air in the room. So take that metal strip, conform it over your nose, and do that. Something else that the FDA, not the FDA, but the CDC has been talking about is the different way of pinching or tying of the ear strings here. So if you take it and do this loop thing here on both sides, can you see what I'm doing? Here, I'll do it differently. I'll do it while it's on. Take one of them and make the bottom the top and the top the bottom. See what I'm doing there? So there's this cross through here. Do that on the other side. Now what did I do? Well, I kind of made it so it pulls it down like from the bottom up and top down to kind of fill in these gaps here, but it's gapping in the sides. So when you do that, you also want to push in the gap part like this. So now it doesn't work the best. It's better than it was before, we'll say that. But it's hard to get, and it varies from mask to mask how well it's going to close for you when you do that. They talk about wearing not just two of the same mask, but different types of masks. They also talk about N95 masks, which we've gone over that before. An N95 mask does not go around the ears if it's a true N95. It goes around the head to really make a seal around the edges. Those things are meant to seal. And what the CDC is trying to do is get more of that seal, because they're trying to get the mask wearers to get more protection for themselves against others, because just throwing on a simple mask like this that's not all that sealed, maybe it's kind of wonky when the person's wearing it, maybe it doesn't go all the way down their chin, it's kind of open here, whatever. It's doing a good job keeping a large number of respiratory droplets and virus and infected people from going out and getting into the air that other people are breathing. But you're not necessarily doing a great job of protecting yourself from other people that are shedding virus. So that's why they're working on, hey, let's tune up these masks so we can make a difference in how vulnerable a person is wearing a mask out there if we make these changes in the mask. Another suggestion that they had was to wear some kind of a nylon sock. I guess you're taking your mom's pantyhose and cutting them or something. I don't know. And keeping it below the eyes, but that will also help to hold the mask against you. And then there's also these commercial elastic bands. So it's like rubber bands, but they're shaped to go around the mask and then around your ears to hold that mask down better. That's another way or kind of an alternative to double masking. So Suki, thank you so much for asking that question. All right, so that was from Suki. And boy, I need to go back to find out where we left off. I thought it was Susie. Susie. Deborah, Cindy told us about we talked about that. Yeah, Suki, talking about that. Catherine thanking us for the information. Catherine, I doubled N95. I thought I was breathing through a straw, but anything is better than COVID. Yeah, to put 2 N95 units on, that's a lot. If it's a true N95, putting a second one on is really not going to do anything significant if the first one has a seal. And of course, healthcare providers are familiar with what you do to actually get checked out on the N95 to be using it correctly to assure that you're getting the advantage of it. This fit testing where they put a hood over you and spray in this stuff that has a very strong taste to it. And so you can tell if the mask has a seal because you're not going to taste it. And if you don't have a good seal, of course, you're going to taste this very strong substance that's sprayed all around. Of course, they test you first to make sure you can tell that there's a taste to it just by giving you a little light dose before you put the mask on. So you go, oh yeah, there's a strong taste to that. Okay. Real Ruler, I have a question for you, Dr. Vaughn, and it's a rather sensitive subject for some. How does one talk with one who refuses to believe it's a thing? And you're talking about COVID-19, I've been hearing these reports of nurses in ICUs who are working with patients who are in the very process of dying of COVID-19, starving for air, and yet still saying it's a hoax, that they're dying of something else, or they're not dying, or this isn't COVID-19, and then they die of it, and they never even believe that's what they're dying from. It's really weird. We've got weird stuff going on in our country for people to be able to, have, like I said, somebody who's actually dying from. What more evidence do you need of that than that? There was a point early on when people could ask, well, do you know somebody who has COVID? When it was new, and it was just in New York, for example, the entire West Coast. You could ask most people, do you know somebody who has COVID? And they'd say, no, I don't know if I have COVID. I can't touch or feel that it's real. But at this point, everybody knows of somebody, or seems like everybody should know of somebody who has had it recently, and maybe even know of somebody who's died from it, with it, taking out 1 in 1,000 at this point, or more than that now. And so I guess they call them COVID deniers. Weird thing, and I think a lot of it has to do with having to feel, and we've talked about this before, having to feel an affiliation with a certain tribe. And that tribe is one that says it's not real in the face of, all the evidence to the contrary. And it's because they, rather than looking objectively at information, when you present them information that's contrary to what their tribe presents them, instead of saying, oh, let me take that information and analyze that and compare it to what I already know, which we call Bayesian analysis, and make an assessment for myself and then go on from there, always taking into account new evidence and seeing how it fits in and either proves or disproves what I've already thought. Instead of doing that, the Bayesian analysis, they stick with what their tribe has thrown at them. And this is a natural inclination to do. We don't naturally have a mechanism with the way our brains operate to go after truth. It's more natural to stick with the crowd. And you could say that this probably has some kind of evolutionary advantage to when you're out there hunting and there's, or in a battle with another group. It's better to be able to work with your tribe than to be right sometimes. We haven't yet got to a point where it's natural to take the steps you have to think something through, think the process through, analyze it, divorce yourself from your emotional investment in the outcome because a friend or someone that you respect or a leader says something different. So that's kind of what's going on there with the COVID deniers. And it's easy for me to say this and have this conversation with my audience that, watches me, and so they probably, have similar beliefs or leanings toward a particular subject as myself. We need to challenge ourselves. Are we just going along with what Dr. Vaughn says because Dr. Vaughn said it, or whoever it is that's worthy of that kind of respect, Dr. Fauci or whatever? Are we also looking to confirm in other sources of information, does it line up? Does it make sense? And if you're to do that with the information about COVID-19, looking at various sources, finding out what information you can from your local hospital or local county health department, people who have had it and gotten over it, putting all this information together, you go, yeah, it kind of looks like something's going around and it makes people sick. And it has whatever symptoms usually associated with it. That would be what you'd expect, would be the conclusion people would come to if they try to, with an open mind, assess what they see going on around them. And so you can tell the difference between people who do that and people who are more committed to an ideology or to a leader or to a particular tribe or Facebook group or whatever the alternative is to Facebook that hasn't been shut down yet. But thank you, Real Ruler 2112, for taking us down that path. Cindy's writing about issues with certain medicines, got both shots, had no reaction whatsoever, had to wait 30 minutes before she could leave because she was in that group that is a 30-minute. I was in the group that was just 15 minutes. Most people, it's just 15 minutes that you keep an eye on them. And generally what you do is at the end of 15 minutes, maybe you can feel it in your arm where you got injected. Real Ruler 2112, someone said he was sick of wearing face diapers and wanted to get infected just so he won't have to worry. When I told him that was a bad idea, but good luck if he decided to go that route, he flew. Yeah, weird. Cindy wears the N95 plus the surgical mask on the... Now there's a combination. You're getting different benefits from the different masks by wearing two different kinds. And so that's probably more in keeping with the spirit of what the CDC is putting out than some of the other ways of doing it, or wearing two of the same mask so you're not getting a difference in them. So yeah, that's kind of a way to do it, Cindy. Deborah, what do you think about masks with filters? Yeah, a filter would also be a... Oh, you're not talking about a filter inside them. You're talking about those little things like that, maybe? So there's masks that have these little one-way valves. I don't know if that's what you're talking about or not, or maybe you're talking about a true respirator, like a gas mask type thing. But there are these kind of N95 style masks with little one-way valves on them. Home Depot would have them for like painters and such, where it doesn't matter what you're putting out. What matters is you're trying to keep stuff from getting in. And as a public health measure, we're trying to keep stuff from getting out. And so that's where just a simple clinical face mask like this or surgical mask works because it's keeping stuff from getting out. The masks with the little one-way valves on them, the purpose of that is keep stuff from getting in. So it's fine for the person wearing it. They've got good protection there. but it's not doing anything to keep bad stuff from coming out and possibly infecting other people. And the concern is people are walking around possibly infected and not knowing it the day before they come down with symptoms when they could be at the peak of their being contagious. All right, 2112, off the handle, saying the numbers are all made up. Anyone dying of everything is being counted as COVID, blah, blah, blah. I'm sorry, are you continuing? That's an interesting, off the handle, saying the number are all made up. Anyone dying of everything is being counted as COVID, blah, blah, blah. Are we going somewhere with that? I think I'm missing finish of that. Catherine, most older folks in our condo complex have been vaccinated and have a second shot. Good. Boo Boo Kitty came in on tribes and missed the conversation. Real Ruler, that's an interesting analysis. Hadn't thought of it that way. Laura Barzik, responding to Real Ruler 2112. Boo Boo's telling everybody just weren't. Thank you, Boo Boo. We appreciate that. Cindy, COVID is real. The naysayers are spreading unreal stuff. They have to make the intelligent decision. Catherine, hubby was in the hospital for a month. He had 2 AVMS, 1 week ICU. I hope to ask our internist when they can get the vaccine. He also has Parkinson's. I'm so sorry, Catherine. She's describing her husband having very, very serious neurologic illness. Deborah, I have pneumonia. My home health nurse gives me IV antibiotic because the doctor doesn't want me to eat in the hospital. Yeah. If you can get taken care of outside the hospital, not get exposed to stuff in there. That's actually a big trend in medicine, is trying to keep people out of the hospital. And what is it we can treat, in the patient's home? And IV antibiotics are a bit of a trick. Oh, Boo Boo gave us a super chat. Thank you, Boo Boo. Appreciate that. Boo Boo Kitty. At Real Ruler 2112, just got here. Heard Dr. Vaughn talk about tribes. Just wonder what I missed. Well, it'll be on the YouTube video. You'll be able to watch the whole thing. Real Ruler, you can't. Catherine, some don't think the moon landing happened, or you can't get pregnant standing. Nice, Catherine. Real Ruler 2112. Bought both my parents' respirators when they started. Wear them whenever they go out shopping. Best $50 ever spent, if it's got a good seal. And so true, Catherine B. So that, oh my goodness, Boo Boo, again. Dr. Bull, you look like quarantine is being tough for you. What? Why are you referring to Dr. Bull? Terry Bull. Of course, we all love Terry Bull. If you haven't seen Terry Bull, there's a YouTube channel, Dr. Terry Bull. And there's some great videos on that from some good times. And if you want to know more about Terry Bull, you want to listen to the Medically Speaking radio podcast, the most recent ones, where Larry talks about his prostate cancer and about his interesting experience with one of those genetics tests for ancestry determination. Very interesting story. I'm not going to tell any more, but that's on the Medically Speaking radio podcast. And those of you who used to follow Terry Bull or know some of the stuff with Larry, or if you came to us through Airsoft Medicine, you'll of course be interested, because that has to do with Larry. And Larry and I do need to do some more stuff together, certainly. All right, Boo Boo, at least 5 people in my mom's complex had COVID. Yeah, last month, throughout December, it was just spreading like crazy. Thankfully, at least in my county, we've had about half the number of cases this month or in January compared to December. And it's continuing to go down. Looks good. People, of course, have concerns about us getting relaxed and not social distancing and masking as well. And these more contagious strains that people can get, even though they had the major strain of COVID already. Yes, those are concerns. Yes, those are the things that can happen. I don't know that we need to immediately jump to that bad thing is going to happen. We're going to go back to where we were. Continue to be careful makes sense. Getting vaccinated makes sense. And I do encourage people to do those things. But because those things are happening, I don't expect us to go back to the really, really bad situation we were in back in December, thankfully. Oh, Dr. Bull. Oh, are you calling? Is that Terry Bull right there? I think he was in some of the Terry Bull videos, probably. All right, so we'll go ahead and wrap it up there. Of course, I know you all are looking forward to Dr. Gawayne's return next week. And of course, we'll be able to give you another show then. Do continue to look at his blog. And he would want me to thank both Boo Boo Kitty, who's here this week, and Teresa Rowett. And I also would thank Boo Boo Kitty and Lindsay Antwine. I don't know where Lindsay is. She's usually here. So we'll keep looking out for her. Also, there are some thoughts, and you could go ahead and comment your thoughts on this. Thoughts about maybe having a little bit more of the vlog type activity on my personal YouTube channel, Mark Vaughn. Some of you are followers of that, and we've had some fun on that with some vacation type vlogs. We've even done some cooking type with, what was it, sheep testicles, I think we did on one of them. Lots of fun, and just all sorts, a whole variety of things, just things in my personal life that I think would make for an interesting video put out there. If you think that sort of thing is interesting, let me know. We might start bringing that up. The reason I bring it up is because we could potentially get up to 1,000 subscribers. I've seen the numbers go up on that other channel, and if that were to happen, we could do some other things with that channel, including even live. Although I think I can already do live just off of the phone, which we do that from time to time. So until next time, Dr. Mark Vaughn telling you